This is room 3, and we have a presentation today entitled Challenges and Choices, Insights Derived from a Survey of Nurse Leader Burnout. The description: Minnesota Organization for Leaders in Nursing desired to better understand the prevalence of burnout among nurse leaders in the organization and develop a plan to help nurse leaders prevent or support existing burnout. The results of this research have added to the body of knowledge about nurse leader burnout so that we better understand the factors that contribute to burnout and the possible methods to prevent or address existing stressors or burnout among nurse leaders. Our presenter for today is Dr. Jenny Procknell, and she is a nursing faculty member here at Winona State University.
So welcome. I'm so grateful for this opportunity to present with all of you today about nurse leader burnout. So we did this survey in 2018, and let me give a little background because we're doing the survey again in 2020. We decided after our first survey in 2018 that we wanted to repeat this survey every 2 years. And I'll tell you some things that we've been doing with this information that we've received from this survey and such. But I suppose maybe let me give a quick introduction of myself. My name is Dr. Jen Procknell, and I'm an associate professor and the coordinator for the graduate nursing leadership programs at Winona State University. I also serve as the treasurer and the chair of the research committee at the Minnesota Organization of Leaders in Nursing. And I led this survey at the organization and all of the things that we've done since then with this data. So I've never presented it to my Winona group before. I've been presenting this content at national, local, state conferences, but I've never presented it to my group. So I'm really grateful to be here and to share this survey results with you. So in 2018, in one of our conferences, we have conferences every fall and every spring each year for our nurse leaders across the state. And we do them in different areas. Usually our spring conference is held in the Twin Cities, and our fall conference is usually held in greater Minnesota or in a rural area. And so in our spring conference one year, we heard from Dr. Rual Kurani, who is the CEO at the Minnesota Hospital Association. And he presented a burnout study that the MHA, or the Minnesota Hospital Association, did with physicians and advanced practice providers. And after his presentation, I was really curious and wanted to explore what is the prevalence of burnout among nurse leaders. Now, I got a group of nurse leaders from MOLN who I knew were teaching at universities, so we're probably really good researchers. And I pulled a small group together and I said, hey, does anybody want to explore this topic with me? And so we did a very in-depth literature search. And what we found is that there wasn't really an abundant availability of literature about nurse leader burnout. We could find a lot about staff nurse burnout or bedside nurse burnout. But we were only able to find qualitative, exploratory, or descriptive studies that explored nurse manager fatigue or moral distress. And really, they were only looking at maybe one group, like just looking at chief nursing officers. You know, a few studies, like one study in 2017 did look at the reasons for nurse leader burnout, but only had like an N of 20. You know, another study was looking at manager job strain. So really, on one hand, we could count the number of articles that told us about prevalence of nurse leader burnout. And even then, those studies were, you know, not very strong. They weren't, you know, really good studies. And we just wanted to understand what the prevalence is. Now, what was interesting also in our literature search, we were able to find that, you know, there was content on how nurse leaders were developing resiliency in high stressed workplaces. But again, the article did not really speak to what was the problem in the first place. So we were really curious, and we knew that this was an area that we needed to research. All right, so why worry about burnout? Why are we even thinking about this? We knew that burnout, of course, and the stress that's related to burnout or that can cause burnout really can affect different aspects of the workplace for nurse leaders, including the quality and safety of care, the patient satisfaction of that care. It can really determine turnover and reduction of work effort and healthcare costs. So it was quite interesting. And we started asking these questions, and we wanted to know how this was affecting nurse leaders. So we put together a survey. We actually met with the Minnesota Hospital Association to see how their survey was set up. And we set up our survey similar to what they did. So the survey structure had about 14 questions. Some of those questions came from the Maslach's burnout inventory. Now you've probably heard this, and it really is only 2 questions in the survey, and they're about depersonalization and emotional exhaustion. And I'm going to talk a little bit more about these categories when we get them. But this inventory is really well-respected measure of burnout among workers in all industries. And the questions in that survey are both reliable and validated. And so we did have to receive special permission to use them in our survey as well. Then there were 2 questions about mentoring and peer support. So we started a mentoring and peer support kind of program at MOLN. So we wanted to better understand its relation to burnout. There were also a few questions about thriving factors. And these questions were created by the MHA's Chief Medical Officers Group, and I'll present those questions in a little here. We also took questions from the Mini-Z. So the Mini-Z is another kind of popular survey. It's a valid, reliable tool, and we had to get special permission to use this one as well, but it focuses on the drivers of burnout, really what's driving or causing that burnout. And then we added questions from the areas of work life. And this was a survey that was created to assess employees' perceptions of work setting qualities that play a role in whether they experience work engagement or burnout. And again, we got permission to use this globally popular, validated, and reliable instrument as well. All right, so the survey criteria, really, if you look at the 3, if you categorize the questions of the survey, it really falls into one of 3 buckets. One of them is the outcome. So what are the outcomes of the stress that they might be experiencing that could lead to burnout? What are the drivers? What's causing the burnout? And then the 3, what are the components of burnout that we're interested in? So here are the outcomes. So the outcomes had to do with satisfaction, like job satisfaction, their stress levels, engagement in the workplace. Whoops, I didn't mean to go forward. And then their overall self-reported level of burnout, okay? All right, so this question about outcomes and if they're satisfied with their job. So the question or the statement on the survey was, overall, I am satisfied with my current job. And then the options were strongly agree, agree, neither agree nor disagree, disagree, or strongly disagree. And notice that a lot of nurse leaders are satisfied with their job. They like their jobs. They like being leaders. And they feel like they do a good job at it. Another outcome, and the statement for this question was, I feel a great deal of stress because of my job. And notice that they do agree or strongly agree with this. A large percentage of them agree or strongly agree. All right, the next question was engagement at work. So the question was which one of the following best describes you? I'm very engaged with work. I'm engaged, I'm somewhat engaged, somewhat disengaged, or very disengaged. And notice that nurse leaders, again, are very engaged or engaged with their work. And then we asked them, which of the following statements best reflects how you feel about your work? So a large majority said that I enjoy my work and I really don't have no symptoms of burnout. And then the 33% group said, well, I'm under stress and don't always have as much energy as I did, but I don't feel burned out. 9% said, I'm feeling definitely burned out and have one or more symptoms of burnout, such as emotional exhaustion. 3% said, I feel completely burned out. I'm at the point where I may need to seek help. And 1% said, I am completely burned out and I'm getting help. So here are the drivers. Remember, the drivers are those things that causes burnout. And so we looked at 3 different categories. So this values, appreciation, and quality, they all scored the highest or the most positive on the survey. I'm going to talk a little bit more about these. The second group, the autonomy, the control, and the efficiency, they scored high, but more people had disagreed or strongly disagreed with time and resources, which was the lowest group. Okay, so we're going to dive into these a little bit deeper. Here are the drivers. So one of the questions was, my professional values are well aligned with those of my senior leaders. And we felt really good about this, that they thought that their values did align with their senior leaders and that they had a common vision and common goal within their work. And that was really good. All right, the second question was, is my work appreciated? And most nurses agreed that their work is appreciated. And the last question in this group is that my organization is committed to quality. And again, all 3 of these questions show a very strong correlation to these drivers. All right, this is the next group that was a little bit weaker in their responses. So the first question there is, I have professional autonomy or independence in my work. And again, we get a high number that strongly agree, but we're starting to see more people starting to either, agree nor disagree, or strongly disagree. The next question is, I have control over my work and how I do my work. And again, we're seeing more people kind of tilt the other direction. Less people are strongly agreeing with these questions. And then care team efficiency, the question was the degree to which my leadership team works efficiently together. And so notice again how most of them said, yeah, we work really well together, but again, we're getting more responses in those satisfactory, marginal, or poor areas. All right, and then the last 2 drivers that really surprised us, well, maybe didn't surprise us, but really kind of confirmed what we were thinking, is that first of all, the nurse leaders did not feel like they had enough time to do what's important, or more of them indicated that they didn't have enough time to do what's important. And they didn't felt like resources were allocated fairly among all groups, within their setting. Then those last 2 questions about the burnout component, one of them asked about emotional exhaustion. Emotional exhaustion would be defined as somebody who is experiencing burnout and maybe has, those general symptoms of being tired, not wanting to go into work. There were a few other criteria that went along with that. But here we see, and we actually compared our data with other providers and nurse, and just kind of the US population in general, all industries, from similar studies. We took that data and compared it to our results. And how did nurse leaders compare? So we're the very first group, the blue line there. And as you can see, we're kind of similar. We kind of float really similar to Minnesota providers, physicians and advanced practice providers. We're kind of right along with how they answered these questions. Some of the questions you will note that we were even less than the US general public. about emotional exhaustion and how often we're experiencing these symptoms. Our other burnout component question was about depersonalization. This is defined as maybe being a little bit more cynical at work or having negative attitudes. And so we can see, again, nurse leaders have a little bit different perspective on this, and that we don't experience the depersonalization as often as others. Here are the results of our deep dive into our mentoring and peer support questions. So one of the questions, question number 36 was, do you have a mentor or trusted advisor? Question 37 said, yes, I have a mentor or a trusted advisor in the past, or no, I haven't had a mentor or trusted advisor. And so they could choose, more than one in this category. And then they were able to tell us, well, then how did you get your peer support? Do you have peer support? And again, they could choose more than one option. So that's why we're seeing percentages that add up greater to or greater than 100%. So 36% said, yes, I currently have a mentor or trusted advisor. 37% said I have a mentor or trusted advisor in the past. 30% said no, I haven't had a mentor or trusted advisor. We were really concerned about the 8% that really don't have opportunities for peer support. We almost wished that we knew who these people were so that we could, reach out to them and, get them especially involved in our mentoring program at MOLN. Or other opportunities. And this really communicated to us that maybe we needed to do a better job in advertising those resources and opportunities to our membership. All right, so now you're probably curious about what the survey demographics were. So let me spend a little time talking about this. So the place where people spent most of their leadership time was in hospitals or critical access hospitals, and you can see those percentages there. What type of a nurse leader of the people were answering our questions? 35% were nurse managers, and then you can see the other percentages down from there. So about 83% of the respondents were married. Most of them were white and female. And most of them, 83% of them have worked in only one place, in one setting. And I will say that we sent this survey out to over 500 participants. We got to about 212 participants, and which led us to a 39% response rate. All right, then we wanted to know more. So we just kind of had like fill-in questions. They could just type in, tell us more about additional specific stressors that you might be experiencing at work. And these were the top 5 themes that rose up from those comments. First of all, communication and personal relationships really struggled. Increasing expectations was a factor. Email and workload management, staff morale, and being responsible for that or feeling like they were responsible for that. And then the limited resources and lack of admin support. So what are we doing? These were suggestions that they had for us, and they really just wanted more education and training, especially on how to balance their workload and do time and email management, how to have strategic communication, professional relationships. They wanted more training and education on finance and other business skills, and they wanted opportunities for networking. So going forward, we're going to advertise our mentoring program a lot more than we have been. In our fall conference this year, it's all about nurse leader burnout, and we're hoping that it doesn't get canceled with the COVID, but we'll see. And every month we do seminars and classes that are focused really on topics that are important for nurse leaders, especially in mitigating burnout.